What is actually, the liver? Liver as an organ. What is it at all? What does it really do for us? Let us see and get some facts about the liver. You see, the liver actually is involved in over 500 functions at the same time. And it's apart from our heart, the liver is the second most important organ. It's really important. That's why I always ask some individuals, have you ever cleansed your liver before? And people even don't know what is cleansing the liver. So from time to time, you need to help this organ because it is the main organ, is the largest organ in the human body. Is the largest organ. It is about the size of a football. The size of football. On the right side, below your rib cage, it starts from it goes slightly to the left a little bit, and then it goes right on your right below your rib cage. So you could see that the other end, the tip is a little bit above the stomach on the left, but the liver mainly is on the right. That's why the right hand or right hand side pain is is as a result of the liver that is not possibly working well, or there's something wrong with the liver. So normally when you experience right hand side pain is because something is wrong with the liver. So the liver is really very important organ involved in over 500 functions. But one of the critical function is removing toxins from the human body. Removing toxins that gets into the body through the food we eat, through the air we breathe in, through chemicals. We are in the chemical way, through medications. A lot of toxins get into the body, and the liver is the organ responsible to remove these toxins from the body. But apart from that, the liver also has some other interesting and very important functions, like secreting bile. Bile is a greenish fluid that it is secreted and stores in the gallbladder. And then at the right time, when you eat any oily meal, like any sunflower, well, I would say sunflower oil is not a good thing, so don't go near it. The extra virgin olive oil or organic coconut oil, where from this you get these fat-soluble vitamins like vitamin A, D, E, and K. You see, these are vitamins we get it from oil. Vitamin A, D, E, and K. And the liver secretes bile to break down this oil to extract this vitamin A, D, E, and K for your body. We know vitamin A is very, very important for your immune system and for your eyes. And we have other functions, but vitamin D is so important for your bone health and for your immune system. It's so important for kidney health. And the vitamin E is so important also for your heart, for your brain. Vitamin K for blood health. So you see, the liver is so important for overall health of your body. You see, the liver produces or manufacture what they call the clotting factors that is needed to stop bleeding. So when you have any injury, it's very important for your body to produce these clotting factors to stop the bleeding. Otherwise, you could bleed to death. So that is why the liver it comes in here producing the clotting factors to stop bleeding. It's really very important. But another interesting point I want you to also to get is that how, in some simple ways, liver cancer can come. Individuals may start with serious liver diseases like liver cirrhosis. It's a loss of liver cells. And sometimes they describe it to be irreversible scarring of the liver. Irreversible scarring of the liver due to alcohol or alcoholism. And that through these liver cirrhosis, liver cancer can develop. Hepatitis is also a ground or is a base for liver cancer. But you see, some individuals may ask, how does the individual get hepatitis? People think that is only through sexual intercourse, through infections. No, not only through that. Listen carefully. Low stomach acid can lead or can contribute to liver. Can contribute to liver disease like hepatitis. Low stomach acid. So those people that are taking medicine that is anti-acid, they should be careful. They are told that they have too much acid, and they go and take a lot of they take medicines against acid. So if you have low acid, it can lead to hepatitis. And then if you have immune system disorder, it can also attack the liver cells, and then hepatitis can develop as well. And then also too much toxins in the body can also lead to hepatitis. And through hepatitis, liver cancer can also develop. You see where we're coming from. Now, let's have a look now at what is really liver cancer. Liver cancer, we have two forms of liver cancer. We have the primary liver cancer, and then we have the secondary liver cancer. The primary liver cancer is just a cancer that begins in the cells of the liver. It begins in the cells of the liver. Secondary liver cancer develops when cancer cells from another organ in your body, this cancer cell breaks off. And then this cells goes through the blood system. And then, of course, because the liver has to filter this blood, the liver is affected. We call that secondary liver cancer. And we can see that secondary liver cancer is more common form of liver cancer. So if somebody has a lung cancer or colon cancer or breast cancer, it is likely that sooner or later, the person's liver can be affected as well. So that's why individuals that got breast cancer and even the breast is removed, it's not enough, because the tumor is not really the cancer. Tumor is the symptom of the cancer. Right. So if you remove the tumor, it doesn't mean that you've gotten rid of the cancer. Cancer is in the blood system. It's in the lymphatic system. Right. So if it is removed, then of course later you can see that an organ can be affected, or even the other side of the breast can also be affected. Right. So now let's come. There's no need to go details of the types of primary liver cancer. It's not necessary at all, but we need to know that we have two types of liver cancer. The primary, which is less common, which is start right within the cell itself of the liver, and then the secondary, which starts from somewhere in an organ, and then the cancer cell breaks off from that organ, swims or passes through the bloodstream, and the liver filters it, and the liver is affected. But now, let's come to the symptoms of liver cancer. What are the symptoms? But before we come to the symptoms, let me put the number on the platform. This number, please contact me for any other form of diseases, not only this disease. If you have any problem with the liver, either hepatitis B or C, just contact me. If you have any problem with the liver cancer too, and you need support just to support the body, for the body to turn around, just give me a call. This number is our WhatsApp as well. It's +44 when you're calling outside the UK. It's +44 738 464 7300. This number when you're calling within the UK is 0738 464 7300. The second number is +44 745 988 9152. This number calling within the UK is 0745 988 9152. Give me a call, just a call away, and any problem that you have will be resolved by God's grace. I tell you that there's healing already in the body. We just need to support the body, and the body will start working beautifully for you. Now, let's have a look at what are the symptoms of liver cancer. Now, let's listen carefully here. Many people don't experience symptoms in the early stages of primary liver cancer or any liver cancer at all. They don't receive any or experience any symptoms at all. But as the tumor, or as there's a growth in the liver, as it grows, then normally the symptoms may start. There's normally pain in the right abdomen. The person may be feeling, full, overly full after eating a little. So when you eat a little, just a little food, and then you are overly full, that could be a problem with the liver, but not necessarily liver cancer. But that is one of the issues. But listen to me carefully, please. Don't take just one symptom and say, Dr. James, I got liver cancer. No. Take about 5-6 symptoms together before you can then come together or come to a conclusion. Now, when we move on, we also realize that the patient may complain of unexpected weight loss. You may be there, you may realize you are losing weight. You eat all right, but you are losing weight. You are wasting away because the liver, which is responsible to distribute nutrients in your body, is not working. So, well, you won't get your vitamins, your proteins will not be metabolized well, and so you'll be losing weight. You'll be wasting away gradually. The next symptom is decreased appetite. So the person may not have appetite to eat. Of course, that can contribute definitely also to weight loss. The person may feel like vomiting, nausea, and then vomiting. And then normally, if that individual presses the right side, they may feel that the right side, there's a feeling, a mass, hard. That area could be very hard below the rib cage, and then also feeling uncomfortable. It's a pressure on the right side. Also, if you go to the hospital and then they diagnose that the individual has an enlarged spleen, then it's also another symptom. Spleen is located in the left upper quadrant of the abdomen, the left side. It's just beneath the diaphragm or next to the stomach in the left side. And the spleen is very, very, very important, responsible for filtering our blood, and they're also very important for immune system. So normally, this spleen can be enlarged if there is problem with the liver, serious problem with the liver. That is the liver cancer. Now, there's also pain in the abdomen or near the right shoulder blade, So you see, pain or discomfort, if you look at the right side of the body, any pain on the right side, your back or your shoulder blade, normally is because the liver, there's something wrong with the liver. It may not be liver cancer, but it could be inflammation of the liver. Sometimes you may experience pain in the shoulder blade. You may experience that. Then also when this disease moves forward or it develops, then of course that individual may have a swelling of the feet and belly, and then even the leg, both legs could also be swollen. That is also another symptom that the person may experience. When we move on, the person may experience itching of the body. So you see, generally when an individual experiences itching, not about liver cancer at all, but itching is because of, normally is because of kidney. The kidney function is also very important. If the kidney is not working well, there's itching. But here we're talking about the liver cancer. So if that individual has a liver cancer, there's itching of the body. Take note of that. And then yellowing of the eyes and skin. It means that the disease has moved forward. When it's getting to the latter stage of the disease, there's a yellowing of the eyes, and that is jaundice, and swollen legs and swollen belly. It means it's gotten to the last stage of the disease. Now, generally, the person may feel weak, and the stool, there's a chalky stool, white stool. It means that it's a real problem. The liver is not working at all. Now, let's come to the risk factor. I know that it's a bit scary to hear all this, but don't worry. If you know the truth, it's good so that you can take care of yourself. You see, there are simple ways I will tell you at the end of this program. Simple way to take care of the liver. I'll tell you. It's a secret, and then you will get to know something to help you prevent any form of liver issues. Now, who is at risk for liver cancer? Who is at risk? Now, a person that is over 50, normally we see in this category, is quite common because people normally got, digestive problems, liver issues. They don't take care of their liver. So normally, simple liver issues through that could lead to this problem, but men are mostly affected than women. You know, a long-term hepatitis B. If you have hepatitis and you don't take care of it, and it can lead to more serious problem. That is liver cancer. If you have liver cirrhosis, cirrhosis is simply is a form of liver damage in which the healthy tissue of the liver is replaced by scarred tissue. That is liver cirrhosis. It's quite serious liver disease. This can also lead to liver cancer as well. Now, when that individual has 2 or more alcoholic beverages every day, those individuals that love to take alcohol, that is also another issue. It can be a risk factor as well. Individuals that are exposed to toxic chemicals. In fact, we live in a chemical world. Now, but if you are too much exposed to these and that you don't cleanse your body, it can be a real problem. There is one toxin that is called mold that grows on peanut and grains or corn. It can be also a risk factor. And those individuals that are diabetic and they are obese, if you are diabetic and you're obese, it's a risk factor because diabetic patients normally have weak liver and weak kidneys. Because if you are diabetic, your blood is normally thickened. So the liver suffers a lot and the kidneys suffer too. So that's why it's very important. It's not about blood sugar level at all. It is about making sure that you have good blood quality. When you are diabetic, you have to cleanse your body, cleanse your blood system to be light, to prevent the complications of diabetes. Now, when we also move on, we also see that another risk factor is what we call the non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease. This is normally accumulation of fat in the liver. Here is because of too much sweet drinks, soft drinks, the Coke and juices. These days, the juices that are even available on the shelves in the supermarket, they are not juices anyway. They are flavors made in the lab. So you don't call them orange juice and pineapple juice. They are flavors. Don't go near them because if you go near them, you have a problem. You can have this non-alcoholic fatty liver disease. It's becoming even these days, non-alcoholic liver disease is becoming even more common than alcoholic disease. I mean, it means a liver disease due to alcohol, And then smoking. You may say, I'm not a smoker. Yeah, you are not a primary smoker. You are not the one smoking, but you could be a secondary smoker. You are next to or standing next to somebody smoking, and you are inhaling the smoke. If you inhale the smoke of somebody smoking, remember, you are at risk. In the UK, 20 out of 100 cases of liver cancer in the UK are caused by smoking. And it's not just the smokers themselves, but also secondary smokers. So you have to be very careful that you move away from those individuals that are smoking, maybe at a bar station or anywhere. Don't stand near them. Move away from them. Let them kill themselves if they want to do so. It's their cup of tea. Now, another risk factor is gallstones. Removing gallstones, not really naturally breaking this gallstone, flushing it out. But if you allow yourself to undergo surgery to remove these stones, you cause scarring, you cause pressure in the bile duct. The bile duct is a canal from the liver into the gallbladder, and this bile duct there could be pressure that could be raised within this duct or within this tube. And that can be a problem. Those individuals that have their gallbladder removed, some individuals, because of gallstones, the gallstones could be very, very painful. So it's because of too much pain, unbearable pain, they are rushed to the hospital, and they have this, they even beg for their gallbladder to be removed. If your gallbladder is removed, you stand risk. You are at risk for liver cancer. If you want to prevent it, then of course you have to take care of the liver. You have to know what to eat and what not to eat, the oils to use, the oils not to use or to eat. You have to live healthier life to prevent unnecessary problem. And the last but one is the chemical called vinyl chloride. That also, it increases liver cancer too. Normally, we call that is the chemical industrial chemicals. It's very, very important that, listeners, that we cleanse the body. We cleanse the body from time to time. You see, what the liver loves very much is the dark green leafy vegetables. Dark green leafy vegetables are really, really wonderful for the liver. It's been broccoli, kale, they're wonderful. Well, cabbage is not dark green, but it's wonderful for the liver. So all the dark green leafy vegetables, all the greens, they're wonderful for the liver. What really the liver hates is sweets. Anything that is sweet. I'm talking about artificial sweets. They kill the liver. And then medications like painkillers, antibiotics, steroids, they kill the liver. Painkillers don't only kill your pain. Painkillers kill your heart, your liver, your kidney, and your gastric system. So this is something that you should put into consideration. And then you need to cleanse your body. It's a therapy that you all need to know. If you want to know about this therapy, give me a call. Give me a call, and then I will help you. I'm here to help you. Knowledge is everything we need. As the Bible said, my people perish because of what? Lack of knowledge. If you don't have the knowledge, then of course, and you are ignorant, you can perish easily. So listeners, do not sit down for something simple to actually, elude you. It could elude you. You may be very surprised. Don't sit down. Give me a call and visit us. Please go to YouTube. Don't miss any of these programs. Go to YouTube, put in Dr. James Natural Link. Dr. James Natural Link. Subscribe and please press the like button and subscribe, and God will really, really bless you. I thank you so much for joining us today, for supporting this program, for sharing. Share anytime I send you messages. Share, and God will really, really bless you. Thank you very much for tuning in, and look forward to having a beautiful, different topic, of course, the coming Sunday, God willing. Thank you very much, and God richly, richly bless you. Goodbye for now, and I'll see you very soon coming Sunday. God bless you. Bye-bye.
If I had 10,000 tongues, it still won't be enough